Okay, hello and hello and welcome to surgery. This is LUWI Foundation representing. In surgery, we are safe to say we have 4 managements specifically, and we have to know all these managements if you want to make it and succeed as a nurse. One of the managements that we have is the nursing care plan. The nursing care plan is something that you have to know and understand. It has to be on your fingertips. The other management that we have in surgery is the post-operative care, the care that we are giving to the client after the operation has been done, after surgery, after theater. Then the other management that we have in surgery is the pre-operative management, and that is going to be our main and major focus for this session. So under pre-operative management, we have 2 types of management there. We have elective management. Elective management is a kind of management that is not emergency in nature. Okay, that's a management where we get to make an appointment before surgery is done. Then when we talk of the other type of management under preoperative is emergency management. This type of management is the emergency in nature from the name itself, and when doing this management, there is no appointment that is going to be needed there. The patient comes in and immediately we have to intervene, because if we do not intervene as medical personnel, the patient is going to die. So quickly we start with our preparations. Now let us look at this scenario where we have a question that is saying, do a preoperative management, or the question requires you to give the emergency preoperative management. This is how we are starting it. Okay, we are starting with the introduction. Before we do the management, first we do the introduction. We are introducing the management that we are doing. So in this case, we are going to say, I will give. Remember, it is you who is doing it, a nurse. So that's why we are saying, I will. Okay, so we say, I will give emergency preoperative care to my client because the condition they present with is life-threatening. Okay, then we are going to go into the M's. Remember, we are required to write about 4 M's. 3 are okay, but I recommend you write 4 M's. Okay, so the first M that we are going to have in emergency preoperative care is patient resuscitation. We are going to say to resuscitate the patient, because if we do not resuscitate, the patient is going to die right there. The second aim we are going to have is to relieve pain. Now, this is emergency, and the patient, the client, is coming in with so much pain. So we are going to need to relieve the pain. So once we resuscitate, then we relieve their pain. When we relieve their pain, now the patient is a bit more conscious now to listen to us. Then we are going to go to the third aim, which is to allay anxiety. Allaying anxiety, we can even phrase it as to give emotional care, or we can say to give psychological care. Okay, so when we are done with the introduction, we are done with the aims, now we are going to go into the main management. The first part of the aim is telling us to resuscitate the patient, and that is what we are going to do. But before we go into patient resuscitation, we need to do a quick and brief assessment on the client, okay? So that we at least take a brief and quick history taking as well. So this is how the heading is going to read: patient assessment and resuscitation. And there we are going to do a quick assessment where you are going to say, I will do a quick assessment and the history taking. Why are we doing that? We want to understand the cause and the nature of the condition they are having. Under assessment, that's why you can even say, I will do a quick I will do a quick check on the level of consciousness using a Glasgow coma scale. Okay, we want to know if the patient is conscious or if this patient is dead already. You might be doing pre-op on a dead person, so we really want to understand. Okay, At this point, we are also assessing the level of pain, okay, mild, moderate, severe, okay, on that scale. It has to be very quick and very brief. Then we go into the main resuscitation. The resuscitation that we are talking about here is the ABCs. Remember the acronym. If you have been following and watching the previous videos, I talked about the acronym, which is ABCs, that we use for resuscitation: A for airway, B for breathing, and C for circulation. So we are going to say subheading number 1, which is the airway. Under airway, we are going to talk about how we are going to make the airways for this client patent. We need to ensure they don't have anything obstructing their airway, because if there's any obstruction, the patient is going to start failing to breathe and they are going to die instantly. So the first point we are going to have is I will remove any presence of secretions using a suction machine in order to make the airways what? Patent. Okay. You can also say, I will remove any presence of dentures such as artificial teeth that can fall off and block the airway in order to make the airway patent. So I'm safe to say on the side of the screen, I have a lot more points running for you and you can check them out. So quickly, we are going to run into breathing. So under breathing, we've made the airways patent. We've removed anything that is capable of blocking the patient's airway. Now we want to ensure the patient is breathing, okay? Because it will mean what we did in airway is in vain if the patient is not breathing. So what are we going to do to ensure the patient is breathing? Number 1, just look at the patient. You're going to see the rising and the falling of the chest. That's a cardinal sign that the patient is breathing. So you're going to say, I will observe for the rising and the falling of the chest in order to ensure the patient is breathing, okay? Then you can also say, I will place the back of my palm on the patient's nostrils to feel for warm air to ensure the patient is breathing, okay? Then the other point that we are on breathing is you can put the patient in semi-Fowler's position in order to allow lung expansion, okay? Then you can also loosen the tight clothing on the patient's chest for more lung expansion. Okay, so we are quickly going to go into circulation. So what about circulation? So now the patient's airway is patent, the patient is breathing, and now let us look at circulation. But when they breathe, is the air going to where it is supposed to be? Because from the general understanding, we know to say when somebody is breathing in, the air has to go to all the extremities, all parts of the body to deliver oxygen and all the nutrients. And that's what we want to ensure in circulation. So we are going to have points like I will press the nail bed in order to rule out cyanosis. Why are we pressing the nail bed? It's for capillary refill. Okay. Then we can also have points like I will cannulate the patient for easy administration of IV fluids. We can also give fluids like normal saline that are going to act as a blood expander in that case. And if oxygen saturation is below 90%, we are going to administer 3 to 6 liters of humidified oxygen. Okay, whenever you are writing the management, remember to say I will, because it is you, a nurse, who is doing that. Okay, so when we are done with the resuscitation, we are going to go back to the M's. The second M is saying to relieve pain. This patient is coming in and they are in pain. In emergency preoperative management, or rather preoperative care, the patient is in severe pain. So we need to do anything in our means to relieve that patient's pain. The point that I'm going to rule out, or the point that I'm going to remove here, is where we get to say I will give diversional therapy such as watching TV or listening to news, listening to music in order to distract the patient away from pain. That point in this management is not as valid, okay, because it is emergency, and the time you are giving the patients to listen to music, watch TV, they are going to be dead already. So you are going to remove that point. So you are going to have points here like I will allow the patient to maintain their desired position away from the pain in order to promote patient's comfort. Okay. Then the other point we are going to give strong narcotics. When you talk of strong narcotics, we're talking about analgesics, the painkillers that are so strong that are going to really help this patient to have their pain relieved. So you're going to say, I will give strong narcotics such as pethidine in order to relieve the patient's pain. When we are done with the pain, we can now go into observations. Why are we doing the observations? We need to ensure all the vitals and everything that we need is in the normal range. If there is any deviations from normal, it is going to be a call for action. So the first point on observations that we are going to have is I will monitor vital signs such as pulse, respirations, temperature, blood pressure, and record to act as the baseline data. So when you record, it is going to be your baseline data in that when you keep on monitoring or checking for those things, those vitals, you're going to be referring to the first ones that you got. Are they improving? Are they getting worse? Are they deviating from norm? Okay. So when you make that point, you're now going to break them down. I will monitor respirations to rule out respiratory failure. I will monitor blood pressure to rule out hypotension and hypertension. So there's a lot of points that you can accumulate from observations on the side of the screen. They are a lot for you. Pick any if you want to get everything. Each point matters and it counts. When we're done with the observation,